Hi, my name is Madeline and I'll be your nurse today. I will be performing your evaluation. I have already applied proper PPE and performed hand hygiene. So can I see your ID band, please? Can you tell me your name and date of birth?
Brian Estrada, 2006, September 23rd.
Okay, thank you so much. Do you have any known allergies?
No.
Okay, how old are you?
14.
Okay, so patient is a 14-year-old male. He has appropriate sexual development. He appears to be awake and alert. During the processing of the history, patient was noted to have facial symmetry, no drooping of the face. Everything is equally bilaterally. He also had a steady gait when he walked into the room. Patient seems to be comfortable. No obvious signs of distress. He is well nourished, and earlier it was calculated that patient falls in the obese category of the BMI. Patient is sitting erect and comfortably. Speech was noted to be clear and appropriate. And he is dressed appropriately for the weather, and he is clean. Okay, Brian, I'm gonna have you perform a few tasks, but before I do that, I'm going to have you answer a few questions. Can you tell me who you are,
Brian Estrada,
where you're at,
at my house,
what month we are in,
September,
and why you're here?
to help you.
Okay, thank you. Can you tell me, I'm gonna test your memory. Can you tell me, repeat back to me 3 words that I'm going to say to you? Table, chair, floor.
Table, chair, floor.
Okay, thank you. Tell me something you've done in the past few days.
I went to school.
Okay, something a little more specific.
We played mush ball.
Okay. Can you tell me what you were doing the summer of 2019?
I was in Mexico.
Okay. Okay, so now that I have tested you that, and let's go ahead and test your judgment. What would you do if your phone broke?
Go get it fixed.
Okay. Can you tell me what it means to hit the books?
To study.
Okay. Can you tell me what 6 times 8 is?
48.
Okay. Can you tell me who the president is?
Donald Trump.
Okay, thank you. Now I'm going to perform a few tests on you. I'm gonna place something in your hands, and you're gonna tell me what the object is. Okay? Can you close your eyes for me? Okay. You can go ahead and feel and tell me what it is.
Battery.
Okay, thank you. You can open your eyes. Okay. Now I'm going to put prick you on your hand, and you have to tell me if it's either dull or sharp. Okay? Oh, I'm sorry. Yes, you have to close your eyes.
Dull.
Okay.
Sharp.
Okay, thank you for that. And then I'm going to go ahead and, can I see the palm of your hand? You can close your eyes. I'm going to trace something, and I need you to tell me what it is I wrote on your hand, okay?
A.
Okay, perfect, thank you. So now we're going to move on to, I'm going to actually be testing your fingers and your toes. You're going to tell me whether I'm holding them up or pulling them down, okay?
Okay.
Okay, can you close your eyes for me? Okay.
Up. Down. Down. Up. Up. Down. Up. Down. Down. Up.
Okay, and I'm actually going to do the same with your toes. Can you remove those for me? Okay, thank you.
Up. Down. Up. Down. Down. Up. Down. Up. Up. Down.
Okay, perfect. Thank you so much for that. You can go ahead and put your shoes back on. Sorry. Okay, now I'm going to have you, with your hands, can you touch your thumb to each finger? Okay, thank you for that. Now, can you take your fingers and point them to your nose and back? Okay, thank you. Now, can you run your heel down your shin? Okay, and then now I want you to take your hands and you're just gonna pat them on your thighs and place them up and down. Okay, sweet. Thank you so much for that. Okay, so now that we have done that, I'm going to have you, can you actually take a stand for me? Okay, we're gonna check out your reflexes. So can I see your arm? Okay, so to test the tricep reflex, I would strike here and your arm would straighten out. And then while you're, can you take a seat for me? Okay, so then to check out your patellar reflex, I would strike on your patella and then your knee would jerk. Your leg would jerk. Okay, so then another reflex we would test for is the Babinski. So I would stroke the side of your foot and go around the top, and it would be positive if your toes would curl. I mean, if your toes would point up. And also we are going to, can you take a stand for me? I want you to walk toe to heel. Okay, thank you so much. And then you can come back over here. And you can stand, stay standing. I'm gonna have you put your feet together and hands outside. And then can you close your eyes for me for 20 seconds? Okay, 20 seconds are up. Thank you, you can have a seat. Okay, right now I will be assessing your cranial nerves. Cranial nerve 1 is olfactory. Can you close your eyes for me? I'm gonna put something underneath your nose and I want you to tell me what scent it is.
Vanilla.
Okay, perfect. You can open up your eyes. Cranial nerve 2 is optic. Your Snellen chart, we assessed it earlier. You have 20/20 on both sides. Now I'm gonna assess your nearsightedness. Can you hold this and read a line off of it?
Tell us about your visit today and you could win 1 to 5.
Okay, perfect. Thank you so much. And now the third aspect, I'm gonna do the confrontation test. Can you stand up for me? Cover up the same eye as me, and I'm gonna assess only one side. Look straight into my eyes, and whenever I wiggle my fingers, let me know when you see it.
No.
Okay, perfect. You could sit down for me. Now, cranial nerve 3 is oculomotor, so we're gonna be assessing your cardinal fields of gaze. And for this nerve, it is up and down, and so I'm gonna go ahead and assess that along in junction with cranial nerve 4, which is trochlear, which is downward and inward cardinal gaze, and then cranial nerve 6, which is the abducens, which is the lateral aspect as well when I do this test, okay? So I'm gonna have you follow my pen light, okay? Okay, perfect. No nystagmus or anything. Your eyes, when they open up, they are symmetrical. There's no lid lag or no eye droopage as well. So now I'm going to be assessing your pupils. Actually, can you look at me? Pupils are equal, round, and I'm going to assess if they're reactive to light. Okay, so look at my top ear right here. Okay. Okay, so they are reactive to light. Now I'm gonna see if they accommodate as well. So can you look at my pen light? Okay, perfect. Thank you so much. And so now we have assessed cranial nerve 3, 4, and 6. Now we can go to cranial nerve 5, which is trigeminal. I'm gonna have you bite down. Okay, thank you. Close your eyes and let me know whenever you feel that I'm touching your face, okay?
No.
Okay, thank you. And your corneal reflexes are intact. Okay, so now we're gonna move on to cranial nerve 7, which is facial. So you have appropriate tear and saliva production. I'm going to be assessing for facial symmetry, which was assessed earlier. Can you smile for me? Puff up your cheeks. Okay, thank you. Okay, the anterior 2/3 of your tongue are intact as well, so that completes cranial nerve 7. So we're moving on to cranial nerve 8. which is vestibulocochlear, which is the acoustic part of your ear. So I'm going to go ahead and, so we would be performing a Weber test. And then we would be performing a Rhine test where air conduction should be greater than the bone conduction. We will be performing, we already performed the balance test earlier where we tested his balance. Now we're going to be doing a whisper test. So can you go ahead and, I'm going to close this ear for you, okay? I'm going to whisper some letters to you, and I need you to repeat them back to me, okay?
Rona 19. CTE.
Okay. And I'm going to perform it on this side as well. 3, 4, 5. 34, 5. Okay. All right, thank you. So that completes that cranial nerve. So now we're going to move on to cranial nerve 9, which is the glossopharyngeal. So then what I'm gonna have you do is, can you take a sip of water for me? Okay, ability to swallow is there. Gag reflex is intact, and the taste on the posterior third of your tongue is intact as well. And then now we can move on to cranial nerve 10, which is the vagus nerve. So the vasovagal response is intact. And then can you open your mouth and say ah for me? Okay, good. The palate and the uvula, they rose properly. And then speech is clear and appropriate, which was assessed earlier as well. So now we can move on to cranial nerve 11, which is the spinal accessory, which is when I'm going to be assessing your shrugging and your head movement. So can you shrug your shoulders for me? Okay. Now can you do it against resistance? Okay, good. And then can you turn your chin to your shoulders? And then the other side? Okay. And then now can you do it against resistance? Okay. Okay, perfect. Now cranial nerve 12 is hypoglossal. Can you stick out your tongue straight down the middle? Okay, and can you move it side to side? Perfect. Okay, and that completes our assessment. Thank you so much.